Truly, it's a privilege to be here. It's our first time at DLD, and it's wonderful to be part of what is clearly a special community. So before I look forward to our futures, I want to take a moment to look back to our origins. And back in 2012, a group of leaders came together to start an experiment. The question was, can you design a venture capital fund that advances health outcomes globally, but especially in low and middle income countries, while also delivering strong financial returns? Over the last 10 years, the results have been pretty compelling. So there's been 15 new products registered from these investments, including, for example, a new affordable vaccine for cholera that's had 230 million doses distributed, and a new gold standard device for treating postpartum hemorrhage, which kills a new mother every 5 seconds. Remarkably, alongside this, we managed to double the investors' capital, proving that you can do well while also doing good. And this was the origin story of GHIC, and something that I can say in full modesty because it was well before my time. But it's something that inspired me through the trio of innovative technology, global health impact, and sustainable financing. And that's something that attracted me to this space and continues to inspire me to this day. The work, very clearly looking around, is far from done. And from that seed, a lot of new efforts have blossomed, including, most recently, our catalytic health investment platform in partnership with the German government, and many others that continue. Clearly today, that work exists in a very changed world, and in many ways a more challenging one. We have geopolitical turbulence, we have drastically declining aid flows and philanthropy, but there's also new opportunities that are arising. Of course, technological advancements, most obviously with AI, but also a broader view of what it means to partner, and a deeper appreciation of this connective tissue that binds us across borders, across ecosystems, and across sectors. This, I would contest, is our new frontier, and we have a stake in all of it. And in this view, I would say global health investment is not just about aid or philanthropy or about capital returns, but it's really the most strategic commitment that a society can make to its own resilience and health. So with me on the stage, I'm very fortunate to be joined by a number of luminaries from 4 continents. So we're very happy to gather here today. What I have just been saying and where I've just ended can sound a little philosophical or abstract. So let's get down to brass tacks and make it real. There's an Ebola outbreak going on right now. John, you have a seat in Ghana. You have a seat here in Germany. What are you seeing in the current outbreak that talks to our health innovation systems, what's there, what's not there, and where AI has a role?
No, thanks, Julian, and thanks for having me here. It's really a great pleasure. Now, with the outbreak that's happening right now in the DRC, the main challenge is even understanding the breadth of the outbreak. I mean, how deep is it? How wide is it? We don't really know. We don't even have the numbers. The articles that are always showing how the numbers are changing every now and then. I spoke to my friend Placide Mbala, who's leading the charge at the INRB in the DRC just last night when we met up, and he was telling me that it's really terrible, and they're now trying to get a grasp of how deep is the problem. So the eyes on the ground cannot see clearly enough. This is the problem of surveillance. The data is not there. Piecing it together is a bit challenging. It's always about estimates, and estimates which will inform how we go about intervening. Where I see AI being able to make a difference is not only in being able to collect the data, but also to aggregate it and make sense of different parts of the data from human health, from animal health, from the shared environment. These all have implications for how we understand the risk of getting the disease, its transmission, and implications for how we can model the interventions which will address the situation on the ground. And I believe it may be on the screen, mobile labs, for example, and Germany has these mobile labs at Bernard Nocht, where I'm a professor. There are these mobile labs which are currently on the ground in the DRC addressing this situation. This is high-end technology, BSL-3 type labs on wheels. And there's the same that they have also in Hamburg as well. And you can see that in the next picture. I mean, this is the kind of infrastructure that is needed. It costs money, takes time, but ultimately it can help prevent a lot of deaths. and give us insight beyond what normal data would do.
Wonderful. That's a great grounding and also an inspiration for what is possible. Susan, I'd like to pass to you. You've been operating in the health security space and driving innovation and the crucible of the very highest levels. What are you seeing on the frontier that's highlighted by Ebola and other situations that's kind of real and concrete for you?
What I see is that we still have systematically not improved our healthcare ecosystem sufficient that we can prevent, detect, respond, and recover in a timely manner to be able to obviate and prevent morbidity and mortality from diseases, both communicable and non-communicable diseases that we know will happen. We know they will happen. This is not a surprise. We know that there'll be emergent infectious disease outbreaks with some periodicity in Africa and around the world. We know that communicable diseases are costing the lives of, we heard it this morning, millions of individuals here in Germany and Europe and around the world as well. And yet we have not structured our health systems sufficient to be able to identify, prevent, and respond in an appropriate manner. And I think we're at an AI conference, and we are at an inflection point in where we can be with health technology, and with how we understand our health at an individual and a population level. The way I think about advancing health is medicine 3.0. So initially what medicine was founded to do is prevent communicable diseases. When we think all the way back to the first smallpox vaccine, the identification that infectious diseases caused harm, caused illness, caused death. And we really put a lot of attention on that. The second iteration of medicine was when we started to realize non-communicable diseases had a significant toll on individuals and populations. Where we are now in medicine 3.0 is we actually have an opportunity to do something entirely different. And you heard a little bit about that this morning, is on the prevention side. When we better understand ourselves from a biophysiological level, and we're able to understand what is health and when do you go from being healthy to deviating, whether it's by the influence of an infectious disease or whether it's a non-communicable disease, and you can upstream and you can intervene at the earliest point in that, that is when we start to embark on this next generation, this medicine 3.0. And the second part of medicine 3.0, which we haven't tapped into and I think is on the horizon, is moving away from a brick-and-mortar based healthcare system, which I will offer is one of the cruelest things we can do to humanity, is if you are sick or you do not want to become sick, you have to go to a brick-and-mortar, a physical site. What that already does is constrain anyone who doesn't have the ability to physically get to that location. John highlighted the mobile health units. That is one great way that we're starting to think about this. But with the advent of AI and prevention and understanding how to actually upstream that prevention capability, where you could, in the homes of individuals, have an assessment on a routine basis in a democratized, equitable way to be able to understand, am I well, is my child well? Do I need to try to navigate to a brick and mortar based system to understand if there's something significantly that needs to be done for intervention? That is when we'll truly see that AI and all of the work that is coming out of the incredible work on biophysiological monitoring, biomarker monitoring, phenotypic monitoring, that is when we'll start to see this incredible inflection point in a much healthier population.
That's wonderful. A great series of insights. And that's what we're trying to do in a fairly short period of time here, is give a series of brief insights and provocations as we go forward. I want to link this to the broader view. So clearly infectious disease does not respect borders. New technologies like AI rapidly diffuse across borders as well. We live in a kind of globally connected world of biology, of capital, and of innovation. So cross-continental and cross-border partnerships are crucial here. Adrian, you've been working at this intersection for quite some time, and particularly in Europe and in Africa. What do you see in terms of a corridor offering between these two regions?
Yeah, thank you, Julian. And actually, I want to reframe it from corridors to bridges, because last night we heard from Steffi, and I think she says that many times at DLD, that it's about building bridges. So let's talk about the bridge between Europe and Africa in the healthcare space. And actually, I'm glad that we talk about a corridor or a bridge, because a couple of years back, people looked at it as an isolated space or problem. There were local problems for local solutions, and there need to be local solutions. And there might have been some people who were saying, maybe there is a bridge, but it's a one-way street. We have innovation in Europe that we bring down to Africa. But we've been, as KfW, investing in fairly traditional venture capital funds that you might know from Europe that are operating in Africa or in the global health space. And what we have observed in these investments over the last 10 years is that this bridge has increasingly become a very busy two-way bridge, actually. So we see healthcare innovation flowing both down from Europe to Africa, but there's also innovation flowing up from Africa to Europe. And just to give you a couple of examples, as you said, Julian, to kind of spark your interest in this. One, if you've been here in January, you might have seen Karim Beguir. Karim Beguir was the founder of InstaDeep. InstaDeep was a Tunisian AI company founded by two people, two laptops, $5,000 in 2014, and they were acquired by BioNTech in 2023. And the acquisition basically was the culmination of a cooperation where InstaDeep and their advanced AI algorithms helped BioNTech actually faster develop the vaccine that some of us actually have in us. And also, with regards to the surveillance piece, it's a nice match because InstaDeep also developed an early warning system for potentially dangerous mutations that BioNTech used in the further development of the vaccine. This is one, you might say it's a one-off. I can give you another two just to stick with you. The leading hearing aid company in the US, which means they're the leading hearing aid company in the world, is based out of South Africa. It's called HearX. They started out with an app that helped local people in actually diagnosing hearing loss or hearing problems over the smartphone. And the last one, which is a much younger company, but also ties in very nicely with the examples that were given, is Yemachi. Yemachi is a Ghanaian company. They're the only company in Ghana that can do full genome sequencing. And what they're doing is, in partnership with Roche, the global pharma company, they're building the African Cancer Atlas. And this is very hopeful in the sense that we see the high tech that Yemachi is doing in Accra, but we also see how Roche has realized that there is vast commercial potential in the under-researched and underused genomic diversity in Africa that will help both save lives in Africa, but also in Europe in terms of oncology. So we really see these examples not just as outliers, but we observe that there are structural trends that make us believe that we will have more of these local to global champions addressing global problems. And I just shout out three quick trends that we see that are driving this. Two are pretty obvious if you vaguely follow the African space. There's a convergence of talent in a very young, increasingly educated societies, and there's an increasing convergence in tech. So smartphone penetration, internet penetration is reaching really levels 80+%, in urban areas much more than that. So it is really very much on par, as I said, in terms of convergence to more developed markets. But the last convergence that is very important in the healthcare space, which was alluded to as well, is that disease profiles are converging. So we have more non-communicable diseases in Africa coming up, and also, due to climate change at least, we have more infectious diseases, heat-related disease patterns in Europe, for example. So what we are seeing is that they have the means, the talent, to work on the same problems that are relevant for us. But they actually, in Africa, have the advantage of starting from scratch. They don't have legacy ecosystems, legacy regulations that hold them back. They can truly innovate in problems that are of global meaning and impact.
Thank you, Adrian. Some powerful examples, and also the vision, which is both, I think, necessary and compelling. And it's a nice segue from your last point. Leapfrog is a term that gets tossed around a lot, particularly in a development context. John, I want to hear your thoughts on this. What's real for you here? Where is AI making a difference? How do you see this term, leapfrog?
No, I think it's a great expression because we've seen this before. If you look at the financial system of transactions, financial transactions in Africa, where mobile money has really taken off, started with M-Pesa in Kenya and then moved on. I mean, the mobile money ecosystem in Africa is way more sophisticated than many parts of the world. That's a good example. But in the health sector, thinking about some of the things we've discussed, today in the area of surveillance, particularly for non-communicable diseases, looking at the interactions amongst non-communicable diseases and infectious diseases. These are very complicated and very unique to spaces in Africa. You're looking at the diversity of the genome in Africa. Over 70% of the world's genetic diversity is in Africa. So if we are not able to train the models using the true diversity of the world, we'll be missing a lot. So I really believe that the opportunity to advance faster than we already have, using these new tools and developing new tools based on just the density and richness of information that there is available on the African continent, we could easily, truly leapfrog and move ahead much faster. There are several examples of this, and there are existing collaborations that we have, which could easily be leveraged right here in Bavaria with the Technical University of Munich, TUM. There's a strong collaboration. The president or vice president of TUM was in Ghana just a few weeks ago. And these collaborations exist. They can be leveraged. The relationships with the Bernard Institute, with several others across the sciences. I believe strongly that Africa does hold the key to leapfrogging with AI and other technologies when it comes to health in particular. And from a One Health perspective, if I may mention, humans, animals, the shared environment, it's amazing. And you get these complex interactions in the African space in very unique ways. And I think that we're just at the cusp of some really great things. And 5 years down the line, I think we'll be looking at ourselves and wondering, what were we doing? So rudimentary.
Right. No, we're just at that starting point, and that's a message that's coming through. I'm looking at the clock. I'm going to have to wrap up with a few brief provocations from you. Susan, what are your key takeaways? What's a challenge and the opportunity here in 20 seconds?
I think what John just highlighted is there's a tremendous opportunity of co-creation, of investing in next generation technologies with John, with others that are in Africa who really are embracing Medicine 3.0. They're not burdened with the legacy systems, and they have the opportunity to leapfrog and then be a net exporter of the next generation of great technologies that can then improve the health in Europe and around the world.
Fantastic, thank you. Adrian, you mentioned BioNTech, InstaDeep. What's the next big story like that in your mind?
I don't have a crystal ball and I don't have time, and I want to leverage that Alessia is still in the room. I think we should invite 5 or 6 of these companies that I mentioned and let the DLD community decide who you think could be the next InstaDeep.
I love that.
Yeah.
Let's seed for January. And John, the final word here. Are we thinking big enough? You mentioned One Health. Give us the next level.
The next level is really going deeper into this One Health. Look, the complex interactions that exist between humans, animals, and the environment have not been explored to any depth at all. And I believe that bringing this new thinking, especially some of the presentations that were done today, collecting routine samples and looking at these and using the individuals as controls for themselves at different time points. This has existed if you think about case crossover designs. Epidemiologists understand this. But bringing this to a whole new level with the environment and with animals, and considering the environment of climate change in which we are now, I think that we should recognize that health is really more than what we've thought it to be. And this fundamental interconnectedness of humans, animals, and the shared environment is a way to think about it.
That's a perfect segue to finish out our session here. We've been talking about what we can see, the landscape we can see now, what we can build together. I want to invite my colleague, Olayinka Fagbayi, onto the stage to give a closing coda. Yes.
That's nice. I haven't even done anything yet, so I appreciate the applaud. I'm going to try to take what's been a global conversation and probably heed what Alessia had recommended for us in the beginning and to go planetary. So I want to do a bit of weaving what I've heard a lot today throughout the conversation. So all day we've been asking, what is it that AI can do for health? Or maybe not do for health. And I want to ask, what is it that health allows us to see about all of our systems? So imagine this, a child with a respiratory illness. She's not just a patient, she's also a signal. She's a signal if we think about the air that she breathes, the urban system that surrounds her, maybe the economy that underfunded her clinic. So her input is not just something that we are trying to solve as an illness, it is also an output of the system within which she lives in. And when we think about health, it really is the most intimate expression of the quality of our systems. All of our systems, our food systems, our governance systems, our ecological systems. So if we want to ask, how great are our systems working? We maybe shouldn't be looking at our GDP. We should be looking at the people that are living inside of the system. How healthy are they? How healthy is a mother that is giving childbirth? Can she survive giving childbirth? Can a community absorb and respond to shocks? Is our children actually growing? And these are not just health sector insights. You want to think of them maybe as like a civilizational diagnostic. And there's something that the diagnostic is telling us, and that is primarily around the circularity of what we experience, that our systems are bounded. And that circularity means that as we, as an economy, we extract from the natural world, we build our economies, we exchange those resources, and with those resources we generate prosperity. But there's also negative byproducts, emissions, degradation, deforestation, and all of those together also invite disease. They invite illness, they invite pathogen spillover, they invite, climate-driven epidemics. But there's also a bidirectionality. There's a positive influence that also happens if we think about the circularity. Because when a health investment works, a vaccine, a treatment, maybe even a midwife that's been trained, that return that we get, it doesn't just remain in health alone. It goes into our economies, it makes them stronger, it makes our communities more resilient, it helps us individually as communities. And this is what we kind of were talking about where capital comes in and enters. It's not charity, it's not necessarily a sector allocation. Capital is the most consequential set of choices that we have about the values that we believe in. So whether you're investing $1 or every naira or every euro, all of that is really demonstrating what we believe about where we want to invest. Is it towards extraction and illness? Or is it that we want to think about our investments that are going to underpin the ecological and economic foundations of the health that we want to see? And I think what I've been so excited about hearing today in terms of AI is that it gives us an opportunity to really see this circularity, make it visible. Think about the planetary health, the Earth AI conversation that we heard earlier. Give us a chance to actually see what we haven't been able to see before. And in true DLD fashion, I feel like we've been talking very technical today, and I want to bring art into the mix a little bit. Because what art does is it invokes an experience for us to sometimes experience things that we don't understand consciously. And even right now, in Germany, there are artists that are building AI sculptures to help bring voice to the Lahn River. They're taking real-time environmental data, and they're translating that data through language models so that the river can speak to the voice of its own condition. So think of AI and art being a revelation of what our systems are saying, that our systems are alive, and that those systems, if we could listen, would probably be telling us something quite interesting and quite imperative and important. So I personally believe that AI is providing an opportunity for us to have better tools for perception. But that's not the only thing we need. We also need a reorientation about the way that we think, a reorientation about the way we make decisions and our mindsets, and making sure it sits within a systemic and ecological and broader planetary understanding. And I think that reorientation, and it was said earlier today, is an opportunity for us to move towards wisdom and not just information. And this reorientation, even though we're talking about novel AI things, or we heard maybe it's from the 90s and we're just repeating and rinsing, that a lot of this is actually quite ancient. It's quite indigenous, this way of thinking. It's been around for millennia. And so we have an opportunity to not only think about making something new, but learning from what we already have. And so I might just want to end, and this has been such a wonderful experience. It's been my first DLD, and I think for everyone in the room, whether you're in tech or finance or policy or design or whatever else you're in, I think all of us collectively together are shaping the systems that are producing health or producing illness. And I think it's really a question of whether we are conscious towards it and conscious about it. And I think that's an underlying conversation we've been having here today. And I think the conversation's not finished. So appreciate you and your time. Thanks.